Welcome everyone to today's webinar. I'm Megan Wood, Assistant Managing Editor with Becker's Healthcare. We will begin today's webinar with a presentation and we'll have time at the end for a question and answer session. You can submit any questions you have throughout the webinar by typing them into your control panel in a space labeled Enter a Question for Staff and clicking Send. We are looking forward to hearing your questions. Additionally, in about a week following the webinar, we will be sending you a copy of the presentation to the email you used to register. At this time, it is now my pleasure to turn the floor over to today's presenters, Dr. Meena Desai, anesthesiologist and chair of Orthopaedic Certification Technical Panel, and Troy Sparks, RVP and Total Joint Program Coordinator with AmSurg.
Great, thank you so much, Megan, and Troy on the line as well, and all of you for attending. We're very excited to be presenting this new orthopedic certification product. And if we could have the next slide, I'll just go into a little bit about ourselves, introduction, and sort of how we've set this up. I'm Meena Desai, and I'm the immediate past board chair of the AAAHC. As Megan has mentioned, I was the chair of this technical panel. I am the past president of the Society for Ambulatory Anesthesia. I currently also am a member of the Ambulatory Care Committee of the ASA, which is the Anesthesia Society. And just on a personal level, I've been involved in ambulatory and orthopedic specialty practice, and currently we have about 25,000 annual patient encounters within our practice. Troy, would you like to introduce yourself, please?
Sure. Hi. Yeah, I'm Troy Sparks, and as we said earlier, I work for AmSurg Corporation. I'm the Total Joint Program Coordinator for our company, developing total joint implementation guides for our centers. I also sat on the technical panel as the standards were developed with AAAHC. Most of my background in nursing has been in orthopedic and spine surgery. So with that, I'll turn it back over to Dr. Desai.
Great. Thanks so much, Troy. If we could get the next slide, I'd like to cover over some of the key presentation points. Number one being, a question that I've commonly gotten asked is, what is the difference between accreditation and certification? Two, I'd like to just talk a little bit about the development of these standards and how we went around developing them slightly differently from standards that we previously had. Third, I'd like to discuss some of the benefits of this type of certification. Number four, I'd like to provide an overview of this as it applies to orthopedics, which is this product. And then Troy will take it from there, as he has been firsthand associated with not only developing standards, but also customer experience, the survey process, and then we'll open it up to questions. Moving on from there, let's start with the first topic, which is the accreditation versus certification. Accreditation, many of us are familiar with. Basically, it's the foundation of today's healthcare delivery, and it's the accreditation afforded to us mostly by those folks that are CMS deemed, and we have several players in that field, or it could be the State Department of Health in certain states. It essentially covers an organization-wide evaluation of all standards and all things involving the organization. For our part, when we do accreditation, we comment on all the standards and all the elements involved within that and that delivery of care. And then, of course, a report is given out with the decision release, which there is usually a little bit of a delay, whether it's a few days or a couple of weeks. In contrast, this certification is specialty focused, in this case, orthopedics. And what we are specifically looking at is the evaluation of care as well as the outcomes in this very specific specialty population. As we go through, when we survey, we will comment on deficiencies around the specialty and the things related to that specialty within an organization. At the end of the survey, so that would mean the day of the survey, we would be providing an executive summary and a preliminary report by the end of the day of the survey. So those are the two differences between the accreditation versus certification products. Going on to the next slide, I'd like to review some of the benefits of this type of certification. You know, why get it? How is it different? Well, being specialty specific, it is truly focused on patient outcomes. And really, I think we need to turn the corner just in healthcare in general so that we can deliver care that is outcome based and outcome focused. So if we have standards that relate to that, I think that helps us provide that framework. The first thing this kind of certification does is it takes your orthopedic team and provides a level of cohesiveness that you can achieve around the standards. And partly that's achieved because it's going to help the facility put together or facilitate consistency in care. I mean, it's been well shown that consistency in care is what produces consistent outcomes. So this is a very good framework around that. Partly, it helps that systematic approach to service line delivery. And then additionally, it helps the organization rise to a higher level of excellence, which is what we are all aiming to do. Lastly, we have decided within the AAAHC that the next sort of level of care not only involves the patient and the center, but also a degree of community engagement, because the patients and our centers belong within a community, and we need to raise outcomes in all locations, not just individually within our centers, but also in our communities. So those elements have also been added. Could have the next slide. Let's now move on to talking a little bit about the standards and their development. And if we could get the next slide, the very first thing I want to talk about is I'm very, very glad and proud of the technical panel that we had put together to come up with this product. It's multi-specialty based and multidisciplinary based, and I think that's an excellent foundation on which to gather the input of all the players in this field. We had well-versed, renowned, and actively working spine surgeons with centers doing this type of thing, including joint surgeons as well. We had hospital as well as ASC senior management involved, both on the administrative side as well as physician services side. Nursing directors were part of this panel. We had corporate partners on a national level, as well as third-party payers, because everybody that played a role in this panel was interested in what the standards look like and having some input in them, because our main goal here is to elevate all of our levels of practice. And of course, I don't want to forget about anesthesiologists who play a key role in a lot of centers in pulling these things together. Into this was research into current clinical practice and guidelines, so we could come up with best practices from this multidisciplinary view. We took this information, and through our technical panel, of course, we came up with a review. Then it went back to our standing standards committee for further review. And then lastly, before we rolled it out, we did mock surveys and a developmental phase, and then had a beta testing launch, which Troy Sparks, who introduced himself earlier, played a role in with his center, and he will have plenty of tidbits and pearls to share with us about that. Could go on to the next slide, please. Now, this certification product actually has 2 levels of certification, so let's talk a little bit about both of them. The basic level is just the specialty certification, which essentially, and these are, you know, I'm going to hit the high points here. It's more by procedure type, so it's minor and partial procedures, such as partial joint replacements, and essentially expects core requirements in this specialty to be fulfilled. The second product, which is the advanced specialty certification, also depends on its procedure type, but these are going to be more complex and advanced procedures. And now we have plenty of them in total joints being done, as well as many complex spine procedures that are done, and other joint procedures as well. And there are many other additional requirements in the advanced specialty certification, which makes everything about this rise to a higher level within your facility. We could get the next slide, please. Okay. So who's eligible? Well, Eligibility it is fairly simple. Our goal was to try to lift those that were doing orthopedic practice. And so specialty certification can be achieved or received by anybody who has another accreditation of their facility, whether it be by the AAAHC or any other nationally recognized accreditation organization. And that could also be your state organization that has accredited you, or CMS certification for whoever is deemed to be giving that to you. Who is eligible for advanced specialty certification? We have particular procedural requirements around that. And so I would say that your center must be performing total joint and spine procedures, and that at a minimum, we have defined that you must have 10 cases done in that specialty area prior to your survey. And certainly more information can be available about that going forward. We could have the next slide, please. Now, this is a very busy slide, and I'd like to just hit some of the highlights of it. And what I'd like to highlight for you is, what did we use as our framework to put this certification product together? What we felt is we needed to highlight that there needed to be effective leadership within the organization to be able to provide the integrated care needed to have the patient outcomes and then the measurement metrics we needed to keep those going. So what did we feel were those areas? And so strategic planning within the organization needed to be done so that we were actually thinking about your specialty certification, and in this case, orthopedic specialty certification, from the get-go, that a plan was actually made around orthopedic specialty certification, not just an ASC and the other multi-specialties that may be there, because I think this population has different needs. What I'd like to highlight in that strategic planning is we would like to see an incorporation of the strategic partnerships that one needs to build for really effective outcomes in orthopedics, as has been shown by several studies. Number two, the providers and personnel around this should be credentialed in a way that shows that they are engaged in orthopedics and are receiving training specifically in orthopedics, and that their scope of practice, their orientation is dedicated in some way, and ongoing education and training be provided towards that. Number three, let's look at quality, or talk about quality and safety. What we did here is we put this category together in an effort to show risk reduction amongst this specialty and within this specialty that was data-driven. So we would expect that in your quality improvement program that you have performance measurement and metrics that you're going to set up and monitor, not only on an initial but an ongoing basis, that are a core of what you do. Because time and time again, we have been shown that the collection of data and the measurement, not only of internal but external benchmarking, is how we are going to elevate our level of quality and safety. Number four, in service delivery, we have found in all of our research that in any kind of specialty service, to take evidence-based practice as well as best practice and put that into place, you need certain policies that are very specific to that specialty and around that specialty. Managing the information and how one filters that through their ASC and all the providers that have the touch points in that specialty is also very important. So that is the aspect of service delivery and integrated care that we are looking for in element 4. Now let's move on and examine the episodes of care, which is element 5. What it's basically saying that all services that you provide here need to be geared so that there are specific time periods and specific items that are done to integrate the approach to properly take care of the patient. Number one there being pre-screening, that you will do of the patient prior to them arriving. So there are certain elements that we will be asking you to look at and certain criteria of inclusion and exclusion that we will be looking at and changing as best practice changes on an annual basis. Because that is something that we have to keep up with, I think, in preserving outcomes for our patients and managing their risk in this ambulatory arena. We will also ask that you continue to assess what you do on a regular level, and we will be having touch points asking you questions around that outside of your survey that you will be sending in information for. We will ask that you have a care planning protocol that you are following and measuring to see exactly how your patients are doing, which extend outside of them leaving your center. We will ask that you look at transitions of care, because we have now found that looking at those where they come into our ASC and go home to rehab, etc., that all those transitions do matter for patient outcomes. And that we will also ask, lastly, that when something clinically is deteriorating within your center, that you really have robust things in place and processes in place, especially detection and management of that, so that the patient still remains with good and as safe of an outcome as we can do, but the early recognition certainly helps within that care. And lastly, as I was mentioning when we first began, that we all belong as consumers and providers of quality of care within a community. And so we need to be able to engage not only the consumer, but also the community. And so there are certain elements that we will be looking at and asking you to participate in, which I think many centers already do, but this will help you formalize that within your program. So feedback will be gained from that, as well as appropriate community engagement. If we could have the next slide, please. And so some of the highlights that might be a little bit different, I thought, let me at least try and review some of that to show you sort of where we are looking for differences and meaning to make a difference with this product. Around the strategic partnerships, we will be looking to have you present and think about written criteria for selecting your partner and what that might be. We'll have an annual evaluation of your strategic partner. We're asking you to do that. Did they provide the service and the partnership that you had expected, etc. We will ask that you have a partnership with a nearby hospital, and many ASCs already do, but that this be a written agreement and that a physician and provider group be participating and or ready to accept your patient. And lastly, we are asking, and everything that has a star on it for the next few standards that I'm discussing will be specifically geared for the advanced specialty, not for the regular specialty, but to get the advanced, you would need these criteria as well. And for privileging, we will be asking that one specialty physician be privileged at both the ASC as well as the nearby hospital to facilitate transfers of patients. You could have the next slide. As far as your credential providers are concerned, we will ask that your medical director, of course, be part of the core team, and for advanced specialty, we will ask that that medical director be board certified. The next bullet point, it has a star next to it because it is part of the advanced specialty criteria, and that we are asking there be written criteria for privileging, and this privileging criteria we will ask for the following elements: that there be post-residency proficiency requirements that are spelled out, that there will be a certain number of cases that need to be proctored, that these cases will need to be peer-reviewed. We will like to see evidence of that. And we will be asking for a minimum number of annual cases be done within specialties and groups. If we could have the next slide, please. Hitting on a high level on performance measurement. For performance measures, of course, for all of the certifications, we will ask that certain measures be collected. For the advanced specialty, we will be asking that you hit a benchmark of 85% or greater. We will ask for advanced specialty that you are collecting this data, not only reporting it with us and amongst yourselves, but also putting it forward in a specialty data repository. That will be a mandatory requirement. That registry must have a national presence. And for example, something like the American Joint Replacement Registry would certainly qualify. Next slide, please. Moving on to pre-screening and consents for patients. We have actually outlined some pre-screening criteria that has specific elements for the advanced specialty group. We would like the organization to establish pre-screening criteria in a very formal manner and talk about how they've done it and when they amend it so that the organization is very clear on how they're selecting their patients. Partly, if there is any kind of discussion to be had about pre-screening that needs to be decided within the medical team, there should be a discussion amongst the medical team. What I mean by that is, if a surgeon wishes to do it, but not the anesthesiologist, we need medical team members to agree and be on the same page. That type of discussion within an organization probably leads to the best pre-screening criteria and choices. So we are asking for that for the advanced specialty group. Furthermore, we're asking for planning for discharge to occur at admission, or obviously prior to admission would be ideal, so that this is not something we kind of leave out just to verify on the day of. We're asking also for that medical record review show not only compliance with the standards, but also a robust element of peer review. Next slide, please. And just to explain a little bit more about community engagement, we'd like to see a written plan for community engagement. And the elements of those plans should include things like health promotion, disease management, talking to partners within the community to develop health promotion activities, which I think are things many of us do already. This is certainly simply formalizing many of these items. In addition, for the advanced specialty product, we'd like to see that health publications, sponsoring of benefits, because these are things that should be available to everyone in the community around you, and they need to be sort of almost advertised or promoted as such, because it's when we do this type of activity that we can really elevate outcomes, because we're involving patients and the community from the get-go. And then, of course, lastly, we'll ask that the outcomes be reported to the quality committee of your ASC. We could get the next slide. Thank you. I've had a lot to say about how we've gotten thus far with our standards and so on. I would now like to turn it over to Troy Sparks, who is going to go a little bit into the customer experience, as he has had first-hand experience being a beta testing site. Troy?
Thanks, Dr. Desai. Yeah, I'll be speaking from the customer's perspective. Our center in Long Beach, California, recently went through the process as one of the beta testing sites, and in fact, they were the first center to be awarded the Advanced Specialty Certification. So I'm very proud of those guys out in Long Beach. So if I could have the next slide, please. So pre and post survey. AAAHC offers a series of coaching sessions, and I can't emphasize enough, these were just an invaluable resource to our center. You have weekly calls with AAAHC. You know, they go over the previous week's standards that you reviewed, as well as giving homework for the next week's. It really helped us to see how the standards were intended and how we were meeting those standards. Our experience with the survey was it was on site with one surveyor, and it was a one-day survey, but this can vary depending on the size and scope of your organization. You receive your preliminary report at the end of the day, so when you get your request for the plan for improvement, there are no surprises on it. We knew that day things that we needed to improve upon, and we had an action plan already put together by the time we got that request for the PFI. And then you have 10 days roughly to get that submitted back into AAAHC. And then again, much like the accreditation process, it goes, once you submit your plan for improvement, it goes to the accreditation committee for the review and decision. And then we had our decision letter within about 2 weeks, and I think that's their goal, is to get them out right at about 2 weeks. So it was a fairly painless process of survey and to the decision. So it was really a good overall experience for us. I can have the next slide, please. So the survey schedule, this is what the typical survey looked like for us. Again, I think this can vary depending on the size and scope of your organization, but typical survey starts about 8 o'clock with a meet and greet. Core leaders then for the program just do a small presentation, just a high-level overview of your program and the activities that you guys are doing. Additionally, we had all of our materials in binders for them just to make it as easy as possible to flow through. Things like policies and in-service records, and this is the things that the standards manual had asked for. So then you're going to review the schedule and modify it if needed. Obviously, this needs to be on a day where you've got total joint cases or the cases going that you're applying for the certification for. Followed that by a tour of the ASC, and that's where they're going to find your patient in pre-op and start to follow them through. And that's the morning's going to be the review of the standards 4 and 5. Those are the patient care standards. And then after lunch, you're going to review the administrative standards like the credentialing processes and things. And that's when they're also going to go see that patient again that they looked at in the morning after they come out of the operating room. And then that afternoon, you have the exit summary. And again, you get your preliminary report right there, so you know what to expect and things that you need to start developing your action plan around. Next slide, please. So preparation, obviously you want to obtain a copy of the standards, and I'll go over later where those are located, but identify the core leaders of your program, physicians and people within your surgery center. Who are those folks that are going to really help to support and implement your total joint program? Who are the key leaders? Attend the webinars, much like today, the education sessions. Again, get the coaching sessions. They were a tremendous help to us. Assign different chapters to core leaders. We assign chapters to our PACU managers, our pre-op and OR managers, really in their specialty lines, and they took those and really ran with them. We completed gap analyses based on those and developed action plans based on where we had any potential deficiencies. And then meet weekly with your team to review your progress. We would have pre-calls to review the call that we had with AAAHC, the coaching session that we had. We would have a weekly pre-call for that, reviewing the call that we had the past week, and then we would also have our list of questions that we were going to have for the upcoming coaching session. And then lastly, keep focused on specialty-specific policies, processes, and data. This was one of the things that we really had to drill down on was, we've got policies and things for all of our cases, but what really are we looking at specialty-specific? What are our orthopedic policies? What are we doing? Why are we doing it? And it helped us to really take a deep dive into why we're doing certain things, what we're doing for our community outreaches, things like our marketing around our total joint program. So it really forces you to look in depth at your overall orthopedic program. If I can have the next slide, please. Advantages, as I talked about earlier, it's specialty specific. It really makes you take an in-depth look at your orthopedic program. Focus on specialty outcomes. It's almost a center within a center. It's a service line you're providing within your center. It really helps you to see it as its own sort of entity. Created community engagement. It helped us to get community outreaches to market our program better. Helped us to streamline the service line delivery. One of the biggest advantages that I can talk about was that it built team cohesiveness. Our team took a lot of pride in preparing for this, and then by the time the day of survey rolled around, man, they were proud to show this off. It was really a good experience for them because they had that level of preparation, and they were a good center to begin with, but they really took this and ran with it. So differentiation, it sets your center apart from other life centers, and as Dr. Desai, alluded to before, I feel like this is going to be even more important as we move in the ASC industry from fee-for-service to more value-based reimbursements. I think we can all agree that that's sort of where we're headed. So it really helps to differentiate your center. And, there was a lot of work to preparing for this survey. It really brought the team together, but the work was well worth it for sure. We found that we didn't have to change a lot of our practices that we were already doing. We just needed to document more thoroughly and take better credit for the things that we were already doing. Again, not a lot of changes in our practices, but it really helped us to figure out why we were doing things that we were doing. Next slide, please. So one of the things that AAAHC wants to help ensure is that you're staying current with best practices, and you're constantly measuring your compliance, and that you're really again staying current with those best practices related to outpatient joints. So they have a continuous self-attestation, and that's an annual form that the surgery centers will fill out in January of each year, and it just attests to the fact that you're staying current with the current versions of the handbook. Healthcare is ever-changing, and total joints are still a relatively new procedure, so just helping to make sure that you're staying current with those standards. Next slide, please. So this is what the typical 3-year certification cycle will look like. Your survey is going to be scheduled. They're going to come out and do the on-site survey. Again, our experience was 1 day with 1 surveyor. You get your report at the end of the day. Your plan for improvement is going to be, you're going to have about 10 days to do that, and then it's going to go to the Accreditation Committee, and again, the decision is going to be released within about 2 weeks. Self-attestation is going to be annually, and then at about month 30 to 33, it's going to be reapplied for the next certification cycle. Next slide, please. So general information and some frequently asked questions. Where do you apply? Where can I get the handbook? The application and handbook are both available on AAAHC.org. And then obviously you'll get the most current standards, when you go through the application process. Next slide. Preparation. Again, as I said, it was a lot of work, but it was well worth it for our center. They just did a tremendous job. I would suggest allowing about 3 months to prepare. I think that'll give you a good amount of time to drill down into your programs and really compare to those standards and see where any deficiencies may be, and to be able to develop those action plans around that. And then the cost of the orthopedic certification is going to be dependent on your specialty program. Are you going for an advanced certification or specialty certification? Are you doing total joint or spine cases? Who are you currently accredited with? So if you email AAAHC, they can provide pricing for that certification. Next slide. And I think probably the most important question that I can answer is, what does orthopedic certification mean for your organization? And it really means that your center is facilitating an environment of best practices and best outcomes. It gives you recognition of striving for excellence and differentiates your organization from other like centers. It's going to provide reassurance to your patients that this center is one that takes this seriously, and it's going to add value to your organization. Again, as I said, as we move from fee-for-service into more value-based, this is really going to add value to your organization. And it's definitely something to be proud of. Centers are encouraged to advertise their certifications. I know that we are, with our Long Beach Center, we're really advertising it and using it to help market our center. So I think now we're going to open it up to questions from the audience.
Thank you for that fantastic presentation. We will now begin today's question and answer session. Tess Poland, Senior Vice President of Accreditation Services at AAAHC, will also be joining us for this Q&A portion of the presentation. Please submit any questions you have by typing them into your control panel in the space labeled Enter a Question for Staff and clicking Send. We will try to get through as many questions we have time for. So the first question is, how would one decide between specialty and advanced specialty certification?
I think that deciding between the two levels of certification is based on the types of cases you're doing. The advanced specialty certification encompasses more of the total joint and the more complex spine cases. the specialty certification is going to be your partial knees and your general orthopedics cases as well.
Great, thank you for clarifying that. The next question is, how do I get started with the AAAHC to see if this is a good fit for our center?
Hi, this is Tess. I would encourage people to contact AAAHC directly or send an email to orthopedics@aahc.org. The email address is listed on your screen right here. We'll have our registered nurse who oversees the certification program contact you and start the conversation with questions about your type of facility, the types of cases you perform, the complexity of those cases, in addition to other types of services that you provide. And we will also follow that with a copy of the handbook.
Okay, thank you for that information. Another audience member has the question, what are the challenges for a multi-specialty ASC seeking orthopedic certification?
So the primary challenge for centers that are seeking certification is really applying the standards specifically to the orthopedic practice. I talked about this a little earlier. It really makes you take a deep drill into what you're doing for orthopedics rather than just your general cases. Looking at data collection and performance measurements, and how does that apply to your orthopedic cases? Yeah.
Great, thank you for that answer. Are you still in the beta site testing phase? And if so, when will orthopedic certification be available for other organizations?
This is Tess. We are almost completed our beta site testing phase. We have one more site to test, and we're excited to launch the program in January 2018.
Great, thank you for clarifying that. Another question the audience has is, if you are AAAHC accredited, can you complete your accreditation and certification survey simultaneously?
Yes, you may. If you are seeking accreditation that is non-deemed accreditation with AAAHC, then we will work with you and our accreditation team to organize the day of the survey that meets your organization's best availability. If you are also seeking, or if you are seeking deemed status accreditation with AAAHC and orthopedic certification, then the survey will be unannounced.
Great, thank you for clarifying that. The next question is, what is the skill set of your surveyors surveying for the orthopedic certification program?
So this is Dr. Desai. We have put together a special cadre of the surveyors that are doing the orthopedic programs. They are actively involved in orthopedics and in ASCs, and those are the folks that have been especially educated to come out and do these surveys. So they are not just the general ASC cadre of surveyors.
Okay. Great, thank you. Another question is, are your standards geared towards the ambulatory care setting?
Yeah, this is Troy, and yes, they most definitely are. With the different levels of certification, they're geared definitely towards the ASC. The technical panel that developed the standards, we had a multidisciplinary team of physicians, nurses, quality folks, and just everybody it was definitely geared towards developing these standards in an ambulatory setting.
Great, thank you for pointing that out. It looks like this is all the time we have today. I want to thank Dr. Desai, Troy, and AAAHC for the excellent presentation, and to our audience for participating today. Enjoy the rest of your day, and we look forward to having you join us for future webinars.
Thank you.